Uh, I received my doctorate in human development and clinical psychology from the University of Chicago many years ago. Following that time, I was an intern and then a two years of one postdoc and to another 2 years of another postdoc. The second postdoctoral experience I had was at the Austin Riggs Center in Stockbridge, Massachusetts. Eric Erickson was there during the time I was there, as well as some other very experienced practitioners. It was an open hospital, and it was basically run with the idea that the therapist was engaged with the patient, and there was a quality of engagement that spoke to building a relationship. It came out of Otto Will was a Sullivanian, and he was analyzed by Harry Stack Sullivan, and he was a medical director at the time. So the emphasis was on the interaction between patient and therapist. So it was at that point that I became acutely sensitive to the importance of the therapeutic relationship. When I finished those terms, I began to teach at the University of Chicago Orthogenic School. I was just running a classroom with disturbed kids, which was a very interesting experience. And of course, one can recognize that with disturbed children, one is running into impasses all the time, particularly if you're a teacher. Children won't do their work, you get angry at the child, and you are then involved in an impasse. Every teacher knows about this. And I got interested in it. And while I was waiting to speak today, it just came to mind an article I wrote about that. And I wish I could remember the quote, but I started the article talking about, it was talking about a child who I had had a very interesting experience with. And but I quoted, we were reading Huckleberry Finn in the class, and Huckleberry Finn says at some point, you know, it's funny, the more I try to make things better, the worse they get. And I think that would characterize what people are doing in an impasse. I think that one way to think about it is both parties are attempting to try to make things better, convince the other party, turn them in their direction in ways that, of course, are self-defeating, and the other party reacts in kind, unfortunately, and does the same back to the patient. And it is the recognition of that that is the most difficult process, but the one that's most fascinating. So in trying to identify and work with individuals and teachers and therapists to identify that experience, it's very important to humanize it and to try to work towards a certain capacity to gain some distance from it, rather than to participate fully in it. However, participation precedes reflection. And so our job is to first encourage our students to get the terrain of an impasse and to begin to see its ways of being, and then to begin to reflect on their experience and to begin to reflect ultimately on the patient's experience of them. So the idea then is to be able to broaden one's vision from that of a somewhat understandably myopic response to the impasse pressures from the patient and the patient's experience of pressure from the therapist into something that has more room and more space to breathe. These are universal experiences. We all know in relationships there are times when people can get into impasses. They don't have a therapist sometimes, and most of the time they don't, in fact, but the idea is, how do they resolve it? They can't all run to a couples therapist. And so that happens in therapy, except therapists have that opportunity to find help and to gain distance. The purpose of this institute, my understanding, is to begin to get people to learn how to identify those experiences and to begin to work towards a certain capacity to learn from them and to gain some reflective distance, but not without the initial phase of recognizing the depth and the contour of their experience. You can't be understanding of the experience until you've immersed yourself in it. So we encourage our students and professionals who would attend to be open to that opening up about how frustrating and impossible and belligerent the patient can be before they can begin to take some steps back to begin to understand something about the broader scope. Right now, you know, I'm being filmed, and I'm being filmed by a camera at a certain distance, a static distance. I think that the process of looking at these experiences is to start with a close-up and then to pull the camera back and to see what else is involved. And so part of that process is to help the student to pull back, to begin to think about what else is involved besides their immediate protective behaviors that unfortunately are making things worse. And to see that they're coming from an important place, but also begin to observe the effects of those behaviors on the patient, and then ultimately to begin to get the patient's view of the situation as well. And so that's a very important turn in the process of turning an impasse into a discovery. Much has been written in the last 30, 40 years about the meanings of the relational ways of looking at these experiences. And out of that has come really two-person psychology, which has been going on for 50, 60 years in the field, and intense examination of transference and countertransference as they interlock, rather than they are isolated. So this institute, the study of impasse, is really part and parcel of a movement in psychoanalytic psychotherapy and psychoanalysis from a view of the interior of one patient's mind into the interior and exterior of both patient and therapist's minds as the events are taking place. And so that, again, constitutes a terrific challenge. And for some, it comes a bit easier, and for some, it's really quite difficult. It opens up territory for how do you understand the nature of an individual's ability to mentalize, to reflect on themselves and someone else, and how that capacity is all important in this very process. And so people differ, patients differ, even therapists differ in their ability to observe themselves. The goal is to try to make a safe and open setting where self-observation is protected, and eventual discoveries can emerge from the minds of the therapist and help those come out from the mind of the patient. No one is immune from this. I myself have certainly been involved in those impasses, and I have devoted myself to try to work them through. Many others have as well. There's some outstanding writings about this, but I think it's important that we try to learn a focused teaching on this experience rather than more of a general, just psychotherapeutic perspective on it. So it means really beginning to do what I like to do, which is there's different ways to do this. My preference is to do a kind of microanalytic, step-by-step examination of the therapeutic exchange that leads to the impasse that we're talking about, and how that begins to, upon reflection, move out in terms of recognizing there are many more determinants than one initially thinks. And the more determinants, I think, that come into play, the broader the perspective is and the greater readiness there is in the mind of the therapist to begin to think reflectively and also productively about what is happening. Once the therapist does that, the patient also picks up there's been a change in the atmosphere. And so the patient then feels, I think, emboldened to begin to join the therapist. But these are tricky steps, and every one of them can go backwards as quickly as it can go ahead. So we also have to be mindful that this is the nature of psychotherapy, and particularly the nature of therapy with patients who have had interpersonal problems and who have come to therapy because of the impasses in their personal lives. So they're likely to repeat that in the therapeutic relationship. And there is no way really for the therapist to guard against it happening, nor should they. They have to taste it, they have to know what it's like, and they have to experience it fully, and then they have to begin to work out of it. So partly this is what is the purpose, the focus of this institute.